What's up, you guys? I hope you're doing good. So today, I'm not going to take too long. I just wanted to address something. So today I got 3 requests to be a preceptor, 2 nurse practitioners, and then the 2 other requests also yesterday. And those of you who already know me, you know my background was a nurse. I was also a nurse practitioner before I made it to this point of being a physician. So I have absolutely nothing against nurse practice. I've gotten multiple requests from nurse practitioners looking for preceptors to complete their clinical rotation. That way they can be set to graduate. But here's my problem with that. I used to be a preceptor for nurse practitioners prior to going into medicine. I've had several students in the past, and there is a problem with nurse practitioner education, and honestly it starts with the programs themselves. You have several nurse practitioner students literally begging for preceptors to complete their clinical rotation, because as a nurse practitioner you don't graduate until you've actually completed those clinical rotations, however many hours that you need in that specialty. But the issue is, most times a lot of places, they're not willing to give them that opportunity. And can I even blame them, right? Because you're actually asking someone to take their time out of their busy schedule to, teach somebody else. And at what cost though? Like no incentive, nothing, which I get it. Most times people do it freely and everything, but a lot of times these programs, they're not even thinking about the fact that these students are having to go to different places, are literally begging for someone to precept them. But the issue is they face that whole problem of just trying to find anywhere. It doesn't even matter if that clinic actually meets the required educational criteria for adequate learning for that specialty. Because the thing is, if a student is so desperate to find a preceptor just to graduate, they will happily just literally jump into any clinic and whoever is willing to give them the opportunity. And then by the time they're done, you start to wonder, what is the quality of clinical training that they get out of that? My main issue is with these programs, especially the online programs, that you take on so many students as much as you can. You collect this tuition, everything from them, and then you're not able to provide for clinical sites. And it's really appalling to have students spend this enormous amount of tuition on nurse practitioner programs, and then they're still stuck trying to find preceptors or trying to find clinical sites to take them. So my thing is, there are still lots of NP programs out there that provide these clinical sites for students. I know some just provide affiliate sites that would just give them a call. These are where our students have gone in the past and stuff, but a lot of them are just stuck just trying to call random people. I mean, today I got random messages and stuff and random emails of people asking if I could please be a preceptor to them, even though I would have loved to take students on if I was already working in my own practice or anything. But right now as a resident, of course, it's not something that I'm able to do. But going back to the whole issue of this problem being, it's more of I see it as a systemic problem that starts with these nurse practitioner programs. Nurse practitioners as a whole get a bad rap because most times a lot of it has to do with the educational training, and it starts with these programs. If you go to a shabby program and the ones that just they're more of a diploma mill, don't care about anything else other than just come through, do the online classes, and just find you a little place to get your training without having to put in the extra work in it, you're going to come out to be a horrible clinician. And I tell everyone, even just as physicians, now being on the other side of it, me being a physician right now, I can honestly tell you there are great physicians and there are horrible physicians. The same goes for NPs. So guys, like I said, I have no problems having students, being a preceptor for nurse practitioner students is something that I used to do in the past before I became a physician. But now I'm in residence, it's not something that is permitted at this time. But when all this is over, I'll be happy to be a preceptor of NP students. Going back to what I was saying, guys, if you're a prospective NP student, please seek out nurse practitioner programs that actually provide clinical rotation sites. And NP as a whole gets a really bad rap, and most times it starts from above. And by above, I mean these training programs. But then again, we also have a say in it. You a nurse practitioner, you a nurse trying to be a nurse practitioner, you do have a say in where you choose to train. And by having that say, that means trying to find a place that gives you the best opportunity to learn, the best clinical rotation site, places where these programs actually have affiliations. That way you're not stuck begging for clinical rotation sites. So believe me, I have been there, and it's one of those things, the frustrations. There are several frustrations when it comes to being a nurse practitioner, and this one This one tops it for me just because think about it, guys. How many PA students do you see walking around looking for, oh, who's going to be my preceptor and all? Because these schools, they take care of it. They take care of it. And MP programs, they also need to start doing this because this is just ridiculous. Students are not going to your schools for free. They're paying tuition. So put that tuition to good use and find them clinical rotation sites. I just needed to vent for a moment just because this thing has been on my mind for some time. I've been meaning to get it off my chest for some time, but since I've been getting these emails from MP students asking for me to be their preceptor and all, I figured I just got to talk about this. Until next time, guys, I do hope you go ahead and subscribe, like, share, comment, and all that good stuff. Thank you so much, guys. Y'all stay real, and you prospective NPs out there, or those already in NP schools and struggling to find preceptors, hey, all you can do at this point is try to do the best you can to make the best of a horrible situation. That's all it is. And again, guys, like I will always tell everyone, they're horrible NPs and they're great NPs. They're horrible PAs, they're great PAs. They're horrible physicians and they're great physicians. It's all about how much of yourself you're willing to apply beyond that medical knowledge, beyond the book knowledge. Some people think once you're done with your educational training, say you're done being an MP, you're done being a PA or a doctor, that's where it ends. But no, so you constantly have to increase that knowledge base and the skill set. That's the difference between an experienced clinician and then somebody that's just like barely just out of school and haven't quite gotten the experience or being at the expertise level. So continue to improve yourself, guys, and be the best clinician that you can be out there, and don't listen to anything else anybody has to say, because at the end of the day, you chose this career, you chose to be where you are, and you own it. You be proud of it because it was your decision. Until next time, guys, it's Dr. G. I hope you guys take care.